Cough, check. Congestion, check. Fever, check. You have a list of symptoms, but in a time of allergies, the flu and coronavirus, how do you know what's making you sick? When it comes to allergies, symptoms tend to stay localized in your head. Do you have a runny nose, itchy eyes, sneezing, maybe even a headache? Chances are you're suffering from seasonal allergies, especially if you tend to feel these symptoms around the same time each year. If you're not triggered by something, it could be a common cold. With the flu, look out for fever, fatigue, body aches, and a cough. It's usually paired with a sore throat. While cold and mild flu symptoms usually resolve themselves, with severe flu and coronavirus, you may get worse before getting better. When it comes to the coronavirus, the Centers for Disease Control and Prevention wants you to look out for a few main symptoms: a fever, a dry cough, shortness of breath or inability to take a deep breath. Also, if you've been exposed to someone who has the virus. Experts believe many people who contract coronavirus will experience mild symptoms or none at all. If you're having trouble breathing, persistent or unusual chest pain, or confusion, the CDC indicates these may be emergency warning signs of COVID, and you should seek emergency medical attention. For today's Health Minute, I'm Meredith Wood.
Empty streets, closed business signs, sights Americans won't soon forget. And a new study suggests if we hadn't done all that we did, staying home, closing schools, restricting travel, staying socially distanced from the beginning of the pandemic through early April, there would be about 60 million more coronavirus infections nationwide. The research published in the scientific journal Nature used a modeling technique typically used for estimating economic growth. It measured the effect of shutdown policies in 6 countries. The study period ended on April 6th, but keeping shutdown orders in place after that time has likely led to even more coronavirus infections being avoided, according to the study's lead author. The study included data on daily infection rates, changes in coronavirus case definitions, and timing of large-scale shutdown policies, but it had some limitations, including that available data on infections and measures across the country studied were limited, and researchers could only suggest estimations about what could have happened. For today's Health Minute, I'm Mandy Gaither.
Sleeping on the hospital floor after a shift. Nurse horror stories from Rio de Janeiro. Hit hard by COVID-19, but poor and struggling. Even in one image that shocked Brazil, the dead lying next to the living. Rio State's medical workers are dying more than anywhere in Brazil. 30 doctors and 40 nurses or workers. Here's nurse Danielle Costa describing her symptoms in isolation days before she died. Her friend Libya, a nurses' union head, has had the virus and is hiding enduring lung problems from her family. She is better though, enough to go back to work. The worst, she says, is when in despair to help someone who's arrived newly in the red zone. We have to stop preparing a dead body for the morgue and leave it to the side. When Danielle died, it was in a hospital 4 hours out of town, and Libya had to fight to get COVID-19 on her death certificate. The last time we spoke, she was radiant, she says. Her dream was to work again in the ambulance service, and her dream was coming true. We queued 4 hours to apply for these jobs. She hugged me, although we could no longer hug at that time. She was happy she would use the uniform again. It was her dream. PPE shortages are complained of, even though in this hospital ICU we're told it's okay. The number of dying in Rio are hard to comprehend, even though some say they're underreported. In this hospital's ICUs, there are 88 full beds, and about 6 to 8 patients die every day. That's about 10% of ICU patients a day. The container's out back with room for 75 bodies at a time. The peak hitting Rio now, some experts think, with healthcare staff already exhausted, mourning and burdened. Nick Payton-Walsh, CNN, Rio de Janeiro, Brazil.
It's an alarming health scare. Teens with symptoms of COVID-19 taken to the hospital, some even being placed on ventilators, but test negative for coronavirus. Instead, it's discovered they were sick because of vaping. The Florida Department of Health recently announced nearly 120 cases of vaping-related lung illnesses statewide. And last month, it was reported teens hospitalized in the Orlando area with COVID-19 symptoms turned out to be affected by vaping. According to the CDC, 5.4 million middle and high school students reported using e-cigarettes in 2019, about 1.8 million more than the year before. Florida's Attorney General says the damage vaping may cause to young lungs is even more devastating when combined with COVID-19. She says parents should talk to their children about how vaping may put them at increased risk of suffering the more harmful effects of the novel coronavirus. For today's Health Minute, I'm Mandy Gaither.